keenly aware of how critical it is for us to really pay attention to how to take care of our brains, how to take care of our nervous system, our central nervous system. And really, this program is about optimizing emotional and neurologic wellness, or more simply put, it's about how do we optimize brain function. We have wellness programs for our muscles, we have wellness programs for weight loss, for taking care of our liver, taking care of our blood sugar, etc. But very few times do we actually consider having a wellness program for the most important organ system of our body, which is our brain, our central nervous system. So in a broad sense, we're going to be covering issues that apply to the way out of depression, anxiety, headaches, fatigue, poor memory, Alzheimer's risk, you name it. Whatever neurologic or brain-related condition there is, this program is going to help you find the keys, the steps to accomplishing your goal, to minimizing whatever genetic or developmental or other risks that you might have towards any of these type of conditions. So it's really exciting to be able to learn this from a whole different perspective, and rather than just treating the symptoms, which have nothing to do with forestalling the actual risk that is coming, that symptom is trying to warn us about. Okay, if the railroad crossing light is out and somebody's waving a red flag or waving a lantern, and we're not paying attention to that lantern, you know, we're at risk. And this is actually close to home, because an aunt and uncle of mine, years and years ago, were crossing at night. We're crossing a railroad, just a railroad that was coming across the country road, and they were both killed by a train that crossed right at the time that they were trying to cross. And in the aftermath of, there was actually concern about why this happened, and the employee of the railroad, who was supposed to be waving the lantern back and forth to prevent the car from moving onto the tracks, he said, "No, I waved the lantern." But the lawyer never asked whether the lantern was on. And the lantern was off. And so sometimes we do all the wave the lantern, and we wonder why the results are tragic. Well, so we're going to be learning many strategies on how to not only feel better symptomatically now, but prevent the actual problem from progressing to a point where it causes serious disease. The experience I wanted to tell you was, I had it about, I think this was 1991. I was working in Sun City one day a week with the Loma Linda Family Medical Group. And while I was there, I was also having some interns from Loma Linda come and just sit with me and kind of see what I did, and have an opportunity to interact with patients. And this one intern that came to spend a few days with me was actually a neurologist who was working on a second doctorate, a neurologist from Europe. And as we sat down with patients that day in particular, 3 different times, as I was talking to patients who'd come back after a month or two of implementing many of the strategies that we're going to be discussing, looking at their cholesterol levels, looking at their uric acid levels if they had a history of gout, or their blood pressure, whatever it might be, and asking, wow, I'm so pleased that you're doing so well. And I'd be talking about the cholesterol and so forth. And 3 people that day in particular, it was a little bit unusual, said to me, he says, that's great. I'm glad that my cholesterol's better. But what I'm really happy about is I'm no longer having those horrible headaches. And if I do have them, they're far less intense, and they go away much more quickly. That's what's really important to me. The concern about those cardiovascular risk factors, as important as they might be for future health, that was far less important to them because they were suffering from serious headaches that impacted their quality of life right then and there. And so there was 3 different patients that day that brought that up without me even talking about it. In fact, I wasn't even thinking about whether or not that headache. We're good, Josh.
Okay, good. Thanks.
Thanks for coming down.
Yeah.
And then, and being a neurologist, she started putting 2 and 2 together. She said, well, what is it about this lifestyle nutritional medicine program that has such a powerful side effect? As we lower their cholesterol, as we lower their blood sugars, or help them lose weight, or help them get their blood pressure under better control, why did the headaches improve so dramatically as a side effect in that sense? Because we weren't specifically trying to treat the headache. She went on to do a doctoral level research project on that very topic that was influenced by that just chance day where she was observing what happened to these patients who had a history of migraine and other headaches. Well, she ended up publishing this research in a medical journal about 5 years ago. And the study basically showed a dramatic improvement in headaches if we were able to improve the metabolism. Okay, so it's one major key to addressing a symptom, headache, which typically is never discussed in the context of metabolism, right? If you have a headache, you take a medication that blocks that pain, whether it's caffeine or something more powerful than that. So the question needs to be, what is actually causing that headache? What is causing the anxiety? What is causing the fatigue? What is causing a decrease in memory function compared to what we had 10 or 20 years ago? What is causing those things? That is the most important question that we need to ask. And it's usually not one thing. It's usually a multitude of factors that come together. And what we want to do in this program is find out what it is for each and every one of us. And it's going to be different. It's going to be different. But as we apply these principles broadly, we get broad effect. We don't just improve the headache. We also improve circulation, lower cardiac risk, improve circulation primarily to the brain in a way that actually dramatically lessens the intensity, the frequency of headaches, as an example. Now, what's interesting is Dr. Susanna Beck. In fact, I think she's a professor at USC Irvine. I guess, is that correct? University of Southern California, Irvine. Anyway, UC Irvine. Thank you. UCI. And she discovered that if you can control your insulin levels, which is the first laboratory that increases or becomes even slightly abnormal when there's a metabolic problem. So before your blood sugars go up, your insulin levels go up. And that higher insulin level is directly related to an increased predisposition for migraines. Okay, so that's just an example of how this process then works. And so we want to then have a broad approach to controlling insulin levels. And you'll understand how that applies to the larger picture as we move forward. So today we're going to be looking more specifically at depression and its causes, mainly because we want to understand depression in a new light. Depression is really a decreased blood flow and perfusion of the frontal lobe of the brain, the most important section of the most important organ of the body. And so many people who actually have depression don't know it. They don't feel depressed. They have other symptoms. But by definition, physiologically speaking, depression is when the brain is not getting the nourishment that it needs, especially the frontal lobe of the brain.